everyone. Dr. Mandell here with you. Hopefully you're having a pleasant day or a night. I want to say welcome to everyone out there. I'd like to discuss a very important topic, bone spurs. This is where we have arthritis, osteoarthritic conditions, degenerative joint disease, generally degeneration. I want to mention a few things. I'm going to go through some pictures with you, show you some x-rays. But let's first get into something really important. We are broadcasting live as we are streaming, as notifications are going out to our chat room, but we'll continue moving forward. Here, as you see this particular picture right here, we're looking at osteoblasts and osteoclasts. Now, don't worry so much about the name. Let me just tell you briefly what happens in a bone. There are two main things. The bone cells are either adding extra bone and calcium as part of the matrix, as well as taking away. So you're adding and reabsorbing, adding and reabsorbing. This is called bone remodeling. And this is happening our whole entire life. It's basically the body staying in homeostasis. Homeostasis is that maintaining balance between the bone reabsorption by the osteoclasts and the bone formation of the osteoblasts. This is what it's all about. So we break a bone, it's cracked, then you have osteoclasts trying to clean it out on the inside, osteoblasts are laying it down. But what happens is when we have too much osteoblastic activity from inflammation, irritation, or stress, injuries, poor posture, this is where we start developing spurs. Spurs is the degenerative process that causes pain because it affects the nerves. Let's go ahead and let's bring you through a little bit of x-ray here. As we look at this, we're looking at bone spurs in the hip. If you look to the left, normal joint space. To the right, you see bone spurs because you have bone on bone. So you have a joint between two bones, and you have articular cartilage on the outside of the bone. When that articular cartilage starts to wear and tear, and there's no more articular cartilage, the body says, hey, this area is unstable. What do we have to do? We got to lay more bone in there, osteoblastic, and we start developing spurs. The problem with spurs is that once it starts hitting bone, or hitting a tendon, or hitting a ligament, or hitting the muscle, or hitting the nerve, it's going to be painful. You're going to get inflammation. Let's look to the next picture. This is the knee. Okay, look at the left knee, look at the right knee. You can see the joint space on the inside, that is the tibia, but that is a bone spur. Bone spur means that there is extra weight bearing, usually in the knees, from obesity, overweight, old injuries, poor gait, imbalance going on in the shoes where you may be pronated. Your foot may be kind of going inwards, wearing the outside of your heels. Pronation, very, very big topic. You can look at my videos on pronation. So we get narrow joint space and we start developing bone spurs. Here's a next picture. We're looking at the neck. This is the middle of the neck, degenerative disc disease, degenerative joint disease, as well as bone spurs. Now, let's just mention real quick. I get hundreds of emails saying, well, I hear that when the discs degenerate, that the body can regenerate and make it thick again. It's like taking a tire and making it bald. Once the tire is bald, it's bald. You can't do anything different about that. But I want to specify something. The body's always taking out calcium or taking, I don't like to use calcium, the body's always repairing, we're going osteoclastically and absorbing, and it's actually adding to it what we call osteoblastic activity all the time. But what happens is this: when we have excessive force or excessive load in the body, there is a law, a cardinal law throughout the whole medical field worldwide. It's called Wolff's Law. Look it up. Wolff's Law means that the more stress there is on a joint, the more calcium or spurs the body is going to try to lay down to help stabilize it. Because when there's instability, the body doesn't know it's unstable. It just knows that something's weak, so we want to try to stabilize it. It's Mother Nature's way of doing things. So you can see that. So the point I want to make, very simple. Bone spurs can be reabsorbed many times more than you think it can. and maybe reabsorb 20%, 50%, 80%. I've seen them totally reabsorbed. But degeneration, bone on bone, is not going to grow thick again. So people say, well, there's stem cell therapy. They're using it in rats. Trust me, don't get that far because you're going to have problems and you're going to suffer. So when we're talking about reabsorption of spurs, realize these spurs are not necessarily in the joints, they're outside the joints. And those spurs, the body, if it can lay it down, why can't it reabsorb it? Because I've seen it. I'm going to give you some tips in just a couple minutes. So here is another picture here of the bone spur here. You can see here, narrow disc space. Here is a lower back picture, degenerative disc disease, DDD, when the disc gets thinner. Osteophytes, which is another word for bone spurs. Look above there, normal disc. You can see that bone spur. Now, you have nerves that are coming out of that area. So the more spurs, remember we said when that spur starts affecting a nerve, it's painful. When that nerve starts affecting the tendon, it's painful. When that nerve starts affecting a muscle, it's painful. When the bone starts affecting the tendon or the nerve or the muscle or the bone below or above, it's painful. It's going to cause inflammation. That's the problem with spurs, because all the body's trying to do is stabilize it. But one tip, the most common degenerative change we see in the lower back is overweight. It's just more load. The more load, the more stress, the more stress, the more degeneration. So if you have degenerative changes, if you have spurs in your lower back, the only way you're going to help this initially, I'm going to give you some other tips, is you got to take the weight off. If you don't take the weight off, those spurs are not going to get better. That's number one. Here we go here. We're looking at something I say for last because this is the most common that I see spurs, the heel spur. All right. Here is another heel spur. Okay. The calcaneus, the heel spur. Very painful. And most people who have spurs don't even know it until it gets to the point where it affects the nerve, affects the tendon, affects the ligament, affects the muscle, or affects another bone. Here's another spur, but this is the Achilles tendon. This is a marathon runner. Look at that ugly part in the back upper part of that heel. That's from excessive wear and tear. The body's compensating and compromising from all the excessive pounding that is taken. Okay, see that right there again, that Achilles heel spur. All right, now, I say this picture right here towards the end. If you look underneath, that is the fascia, all right, underneath the foot. When that fascia becomes contracted, it pulls right where that calcaneus, right where that heel bone is, and it just starts tugging and tugging and tugging and tugging. And over time, the body says, hey, this is weak. So what do? We start laying in calcium. And that calcium is a heel spur. So the first thing you're going to do with heel problems is you got to get the stress off. You're going to have Tuli's, it's called T-U-L-I, Tuli's heel cups. They're excellent. You get them on Amazon, you get them anywhere. Tuli's are one of my favorites. They have heavy duty weight and they have the basic. I always like heavy duty, even if you don't weigh over 160 pounds, because they go by weight. But the more cushion, the better. You need to get the stress off. You need to make sure you're supporting the arch. You've got to get that pronation off and out of the shoes. You got to get those, keep those shoes from rubbing up against either the back of the shoe. You got to get the stress off. Number one, you must take the stress off. So let's go back to a couple of questions that come up quite often. How do I get rid of these spurs? How do I help these spurs? Well, a few things I want to mention. If we come over here, we look at the neck. The most common spur formation is forward head posture. And there's no one here on the internet that talks about forward head posture than this guy right here. Why? I've been through all kinds of neck problems, neck issues. I've seen it. I've seen thousands of patients. I've done more hours than probably scientists on the internet when it comes to neck problems because I had the issues. And I bailed out learning the facts and learning all the intricate things to know about neck problems. And one of the leading things that cause degeneration is forward head posture. You can go through my videos. I have so many of them. It tells you the degrees of stress. Our head is 12 pounds. For every inch we go forward, an additional 10 pounds of stress. And these are the stresses that cause degeneration. So number one, you need to start practicing chin tucks. You need to start strengthening the rhomboids, get those shoulders back. You need to start jutting the chin in. You need to start stretching the chest and the door to open up the pec muscles. You need to really be conscientious of forward head posture because that is number one for neck. Okay? Now, if you come over here, we talked about that. Let's see if I can come back here just for a second. Regarding hip, we talk about obesity. We talk about extra load, strengthening core. Remember, anytime we have calcium or spurs, we have instability. We're all going to have degeneration as we get older, but we're talking about spurs at 20 years of age, 30 years of age, 40 years of age, 50 years of age. And these things are not necessarily inside the joint. They could be outside the joint, but you're getting it because of the body's instability. A few things. Anti-inflammatories, my favorite, ginger, turmeric, around 500 milligrams. Quercetin, bromelains are great natural anti-inflammatories. Boswellia with frankincense. There's some great formulations. One of my favorite, and this is probably the best one you'll ever have, and I've done many videos on this, is apple cider vinegar. You're looking at someone who had what they call my rotator cuff tendinopathy, but I had a significant amount of calcific tendinosis inside my supraspinatus tendon. And within about 8 to 9 months, I absorbed about 85% of that calcium by doing apple cider vinegar. I do 1 tablespoon to 8 ounces of water. You can do it twice a day. I do it first thing in the morning religiously. And I will tell you that not only will that help absorb bone spurs, because what it does, it changes and rebalances the pH that helps naturally dissolve spurs, just not in the heels, okay, but throughout the entire body. I can attest to this, and I can attest to this not only for me, but through not 10 or 20 or 30 patients, but hundreds of patients over the years. I've been a long believer in apple cider vinegar for many years. And I've been doing this for several decades. Okay, I've been around. All right, so I've had a lot of experience with this kind of stuff. And I'm telling you that this is something that is just remarkable. But I want to say this, that's extremely important. You must take the stressor off the joint. Okay, because if you're just going to use certain things without really getting to the root or the cause of the problem, you're not going to really solve the problem. Another one I love, Epsom salts. Something within the magnesium, that absorbs into the skin has been a healer. Maybe it's that combined with the warm water. I don't know. Okay, but I have had amazing, great results. Remember, most of these spurs, most of these osteophytes are asymptomatic. People have these for years. And if I took pictures of 1,000 people, I'm going to find 60%, maybe 70% of these people, I'm going to find spurs in there, specifically after 30 years of age. I will find spurs. You take athletes, you're going to find spurs in all of them because you're pounding. Now imagine doing this all day long. This is pounding in your neck, little by little, okay? Postural problems, obesity. Here in the United States, we got so much obesity. Well, guess what? Look at the knees. If I can find them, look at the knees. That's obesity. That's excessive weight. That's excessive load. The body's trying to compensate. So number one, if you really want to help this, you got to get on an anti-inflammatory diet. You need to cut out the sugars. You need to get rid of all that enriched crap, excuse my language, all that processed stuff. And, watch those trans fats. Start really eating the good nurturing roots of those good vegetables, particularly organic if you can get them. If not, just clean it very well. But get the micronutrients, the vitamins, the minerals. Start juicing. There is, Dr. Walker, I read his thing, I think when I was a kid. And that guy is the juice man, I tell you. And what that man says is right. That juicing does miracles, because those minerals will repair. Those minerals will take and reabsorb and help clean out the cells and the blood vessels and the veins. It will detoxify the liver. It will just do remarkable things for the body. Juicing is a really great thing. You know, a lot of my listeners out there know about juicing. You're really proactive. But I'll tell you, man, you really start cleaning up your diet. You'll be amazed what the body can do. Don't ever underestimate it. I really hope that you enjoyed this program. I know there's a lot to say, but I'm trying to make my point is that we really need to back up and say, listen, let's start doing things right, or do the best that we can, because, you know, I say this over and over again, you know, we can wear out our car and change our parts, change our tires, our washing machine, our refrigerator, change the parts. We can wear our teeth. We can get substitutes. But if you wear out your body, where are you going to live? That's the big question, because once it's worn out, it's it. Don't start looking at stem cell research, and don't start looking at doctors where you have to go out and start using your insurance. Of course, they're going to treat everyone if you got insurance, but that's not where it's at. It's not about doctors. It's about you. And I really stress to you is really try to preserve your health. Try to be really smart. All these people in my chat rooms, I want to say thank you. I love you. I really love you, because you're doing the right thing. You really are. You're staying proactive. I don't have all the answers. No one has all the answers, but I'm trying to give you a good experience from what I know, from what has helped other people. Are these things going to help every person in the world? No. Are my self-help videos going to help every person in the world? No. The reason why I do so many of them, because I'm hoping that with all the ones I do, I'm hoping I'm going to help all the people in the world. You know, that's my goal. So anyways, I want to say God bless to everyone out there. Keep up the great work. And I apologize for the delay of time of this video, but I really wanted to get my point across. Anyways, I'll say no more. Make it a great day. And if you haven't subscribed, please do so you get those notifications. Check me out, Motivational Doc, on Facebook, as well as please leave your comments below. I will check them out. Bye-bye now. We'll catch up with you real soon.